Hello and welcome, James Weber here from the Shoemaker Public Safety Center, here to give you a bit of a review of your module number 6 questions from your blended learning advanced EMT program. So we're going to start with critical thinking, like always. And critical thinking question is, again, a call in which I was once on. Obstetrical emergency with associated cardiac arrest is the dispatch, met by an Amish family that takes you upstairs. Midwife hands you a newborn female in cardiac arrest. Midwife is unable to answer questions as she doesn't speak English. Mother of the newborn is unresponsive in bed, pale, cool, and clammy, but breathing. Family says she'll be okay. You aren't here from her. You aren't here for her. Don't touch her. Okay? So again, you have a newborn in cardiac arrest and an Amish woman laying in bed, unresponsive, pale, cool, and clammy. Family says, don't touch her, you're not here for her. How do you deal with this situation? What patient are you going to focus on? Please list in order the 7-step treatment plan for the patient scenarios we listed. Now, this one's tough because it requires you to basically manage 2 supercritical patients simultaneously. Now, we were lucky in that particular circumstance. The fire department was there already and actually had the EMT on scene. And we looked at him and said, hey, listen, we're going to call for another ambulance for her because even if she doesn't refuse, we need to at the very least open up a patient case for this particular unresponsive woman, and allow for the potential for refusal, or at the very least, if she's unresponsive, get her off to the hospital. But we needed to focus on this child in cardiac arrest. So we actually transferred care of her to the EMT that was on scene from the fire department. EMT from scene from the fire department treated that particular patient probably for about 10 minutes until another ambulance arrived. She remained unresponsive, and that ambulance crew actually took her through implied consent to a local hospital, right? So my point is, we have to actually get both of these patients care. And we've got to climb outside of maybe, what's considered normal and get a little creative on how we're able to actually make sure that that particular patient gets care. And once that's done, we've actually got to get this patient to the hospital pretty quickly, right? And treat that cardiac arrest on the way to the hospital. I will tell you that this child actually had some pretty significant birth defects. The vagina and the anus were actually fused, missing part of the heart, missing part of the lungs, or not part of the lungs, missing part of the heart and part of the brain, right? So that's part of the reason why child came out in cardiac arrest and stayed in cardiac arrest until she eventually was pronounced at the hospital. But it doesn't change the fact that you have a sudden set of decisions to make. I get 2 critical patients and 1 resource. What am I going to do? You're going to be able to manage that. We're looking for any treatment you're going to apply to each one of the patients. Now, if you said, I'm going to stay on scene, do CPR, and manage the second patient under the idea of implied consent and call for a second ambulance for transport for that patient, I don't know that that's unreasonable per se, as long as you're able to support that answer with logic and reason and apply what you actually learned to the question. So that's critical thinking question. Let's talk a little bit about the essay. Essay was actually more of like a bunch of individual kind of questions, right? What's commotion cordis? What is hemothorax, pneumothorax, hemopneumothorax, and cardiac tamponade? Again, commotion cordis is where you experience trauma at the right portion of your the QS portion of your complex of the beat of your heart, which actually induces cardiac arrest. It's part of the reason why kids on youth baseball teams actually wear chest protectors, right? But do a little bit of extra research on commotion cordis. Is kind of an interesting pathology. Hemothorax, pneumothorax, hemopneumothorax, all super connected. If you answered this question by basically answering what all of them are and kind of doing a compare and contrast, that's a good idea. But basically, hemothorax, hemo, blood, pneumothorax, air, and that's extra blood and extra air in the chest or in the chest cavity, which doesn't allow the lungs to expand and contract completely, right? So hemothorax, pneumothorax, hemopneumothorax. Of course, hemopneumothorax is blood and air in the chest space, and cardiac tamponade is when the heart actually no longer has the ability to contract and expand efficiently the sac of the heart's actually filled with blood, and it's being tamponaded off from its ability to expand and contract in a reasonable way, simply because the sac around it's actually full of blood, right? So pericardial tamponade is the most common application of this. Again, it's when the pericardium fills up with fluid or blood, one of the two. We've seen it with infections, we've seen it with blood, and the heart just can't, there's pressure on the entire outside of the heart, so it can't expand and contract and expand and contract and expand and contract in an efficient way, right? So if you explain those three things with at least 350 words in length that got into real big detail with pathology and management of each injury, you were right on point with where we wanted you to be. And of course, the journaling question, we've talked about this before, it's really just taking what you learned, again, for this particular module, in a deep dive on how you think it's going to apply to what you've learned historically, as well as what you already previously knew in your practice, and how it's going to apply in your future practice as an advanced EMT. So this is module number 6 in a nutshell. You're coming on the tail end of your program, so we hope this helps kind of explain what we were looking for in our grading. We appreciate your time, your patience, your energy, like always, and we look forward to seeing you at module number 7. Have a wonderful day.